I'd now like to demonstrate for you what's been called an Appianis maneuver for treatment of horizontal canal, Canalithiasis, benign paroxysmal positional vertigo. We're going to assume that our patient here is affected in the left horizontal canal and that it's free-floating debris. So in order to execute this technique, what we're going to first do is we're going to place our hands over the patient's ears and we're going to ask the patient to place their hands over our forearms. Next, because it's the left side, what we want to do is ensure that the debris is located in the posterior region of the canal by asking her to go slightly back and to her left. Here in this position, the patient will be asked to stare at our nose, and we're going to assess for any nystagmus that may or may not be present. Typically, it's already located in the posterior region of the horizontal canal, and so this may not be necessary, but it's good to assure ourselves that it's in the correct region prior to execution of the rest of the technique. All right, so the rest of the technique now is to go directly onto the patient's right side, and we're going to go lay down on their right side for about 1 minute to 2 minutes, okay? We're going to come on down here. Take the patient down on their right side, again assessing for any nystagmus that may be present. In this position, it's recommended that you hold for 1 to 2 minutes. However, given that it may be free-floating debris, or it is free-floating debris, we would expect that the nystagmus would cease across a period of time. And after the nystagmus has ceased, I would typically recommend that you double that duration in order to maintain this position. After that's been accomplished, what we're going to do is we're going to switch our hand position here, and we're going to next rotate the patient's head quickly, 90 degrees down, allowing for the evacuation of the debris out of the horizontal canal. In this position, the patient may complain of some dizziness or vertigo again, and it should cease over time. Again, double the duration. And next, what we're going to do is just have her sit straight back up. So I'm going to switch my hand position again and come back up for me. All right. And we're going to hold that position right there. And that's how you execute an Appianis maneuver.